should be able to work on that. Maybe another point I would like to make on this is the area of training. Ultimately, the quality of people we have in the industry, or any industry really, depends on the quality of output from universities. Ultimately, we can't get anything better than what is coming from the universities. I graduated from the faculty in 1994. I'm not sure now, maybe September or so. But by the end of that year, I started my internship with Pfizer. And you do 6 months in the factory and 6 months in sales and marketing. So my first 6 months, I went to the factory. Before I left here, well, I have seen a mixer in pharmaceutics. I have seen some things here and there in pharmaceutics. Today I know it's not a 5-star facility, I know, because I've seen bigger, more modern facilities. But when I entered there, I was like, wow. It was a different world. Very different. And I believe same thing for a lot of students who will live here today. When they get there, they will be surprised that things look very different. And the truth is, technology keeps moving. It doesn't stay static. It keeps moving. And those of us in manufacturing, because we are heavily regulated, you must keep up as things move. You must, there are about 4 manufacturers in Nigeria who have WHO certified facilities. A lot of them are pursuing it. To get those certifications, your systems, your infrastructure must be up to date. So they are available there. And I think the closer we work together, students can be exposed to these things. Even lecturers, a lot of theory you understand them very well. But the practice, how will I say it now? Well, the practice, the reality is a little different. You also need to see some of these things so they can go into your curriculum. Today, a lot of fresh students, very sharp young people, come into the industry. We still spend a lot of time and money to mold them to be able to do what we want them to do. And I think it will be in their interest if they are better prepared from the university. Their chance of getting a job is even better. If I interview 2 people, and I think this one appears to understand the industry more than this one, I would likely take that one. So their chances of getting a job is better if they are better prepared. And of course, their chances of fitting in and giving value to the organization is a lot better if they are prepared from here. So, and I think that can only happen if we work more closely with you and you understand our needs. You are the experts. You can easily backward integrate, as it were, to bring that into the curriculum. The other specific areas I would like to highlight very quickly. The first of them is new drug discovery. Areas I believe as industry we are looking up to you. There are diseases, mostly infections, that are peculiar to us in this part of the world that is not a problem to the rest of the world. A common one, malaria. It took forever to get a malaria vaccine. Maybe the malaria vaccine we have today is probably 5-6 years old, being used. COVID, it was a number of months because the people that matter were impacted. In the last 30 or 40 years, I doubt, correct me, you are the academics, I don't think there's any novel molecule for malaria treatment. Something new. It is older molecules that we are recycling and now turning into combinations with artesunate. But there's really nothing new. For obesity, there's a new drug, new molecule virtually every year. For hypertension, there's a new molecule virtually every year. For dyslipidemia, there's a new molecule virtually every year. Because it impacts the rich world. For cancer, there's a lot of research and money is going into it because it impacts them. Our problems are not their problems. There's no incentive to invest in them. Today, you are academics. I'm sure you know there are things called NTDs. NTDs are neglected tropical diseases. Diseases like onchocerciasis, schistosomiasis, elephantiasis. I read recently that a few snake bites are now classified as NTDs. There are snakes that are in this part of the world that is not in the developed world. So you get bitten. Nobody's interested. So a few snake bites are also classified as NTDs. They are called NTDs because there's no focus on them. There's no funding for them. There's no research for them. But they are killing people here. I think we have a moral responsibility, particularly those of you who are in academia, to focus on some of these things. The treatment will not come from anywhere. There's no interest. To take some of these neglected tropical diseases, if you are able to find something, we are willing to work with you to commercialize them, and you can also get value from them. They are, like I said earlier, I think asking for new chemical entities is a tough job, I know. But I do not think that it is too far-fetched to expect that we can modify existing molecules to make them probably a little safer, probably a little more effective. I know I have read a report of Asia where there were a few specialists or a few professionals, a few academics who were working on new uses for older molecules. Who knows, some of these things, if we test existing molecules on them, we might get something. So I think academia needs to look at some of these things to see how they can address some of these problems that are unique to us as a people. Another area where I actually believe we have a lot of advantage as a people is herbal medicines. Before the advent of Western medicines, we were treating our problems. Our fathers had certain knowledge, and they had herbs that were doing things. One will assume that with the modern science knowledge we have acquired, we should be able to build on that. I want to say, maybe with a level of pride, one of the leaders of that team is here with me today, that Fidson is the first company in Nigeria that has actually, maybe in the last 10 years, focused on herbal medicines. We have a unit that we call Sestra that is focused primarily on herbal medicines. It is headed by a very senior pharmacist, a fellow of the PSN. The team has about 30 people, maybe 20-something of them are pharmacists, young people. Last year, the turnover of that herbal business was over 3 billion naira. It tells you there is potential. And please note, we are not selling the medicines on buses in Lagos, no. These are medicines that we sit with doctors, discuss. They are convinced to prescribe them. And I'm not talking aphrodisiacs. I am talking products to treat infertility. I'm talking products for endometriosis. I'm talking products for arthritis. I'm talking high-end medicines. And unfortunately, virtually everything we sell comes from India. Okay, there are two we manufacture locally, but we actually still import the raw materials, the herbs. We just put them together here. And why are we able to sell them to professionals? It is because there is solid clinical data. They've done clinical trials, published them in respected journals globally. We have done a few trials locally. That if you sit with any professional, look at the data, you can't fault them. You can't. Today, I have no doubt that even in this faculty, there is a lot of research and herbs available. I was with a classmate of mine yesterday. In her office, she was telling me, I was telling her for the very first time, that there is a herb in this faculty for treating malaria. She said, I have used it, it works very well. And she said, okay, the faculty has a few reps who sell them. And I'm like, what? I don't think the faculty is equipped to sell them. I don't think so. I do not think you make a big success of them. If there is sufficient clinical data, I will advise you to talk to a company whose primary job is marketing. They will make it big. But the point I want to make is there is a lot going on. There's a lot of available data here and there that because there's no synergy, it's essentially more knowledge than usefulness. And I think that has to change. Another area I think is important to us in the industry is process improvement. Let me share a story here. The pharmacist will understand. If you're not a pharmacist, God will give you understanding. When I was running the factory, we used to make a brand of metronidazole tablets, 200 mg. For some strange reason, we were not able to sell. our cost was the price that people imported brands were selling in the market. We couldn't understand it. Is this substandard? We bought many brands, analyzed 200 milligrams per metronidazole. We spoke to a few people, and they connected me to someone in India who said, I will talk to a CRO. A CRO is a contract research organization. So they put me in contact with one. They said I should send our tablets. I sent to them. It took about maybe a little over a month, and they got back to us. They have a solution. What is the solution? They said this is the fee. Okay. We paid the fee, and they sent the tablets back to us with a new formulation. Maybe, I'm not sure of the numbers, but I'll just throw something at you. Maybe our average tablet weight was about 250 mg. Active was 200 mg. If you add all the excipients, about 250 mg. What the CRO did was to reformulate the product that the average weight come down to about 225 milligrams. Except you put the two tablets side by side, you won't know that one is smaller than the other. The only investment we made was in punches and dies. We were packing them in the same blister strip, same pack. You won't know, except you compare them. But if you shave off 25 milligrams of a tablet, and you are making